Today we're going to take a journey inside the human body. We're looking at a pretty remarkable medical procedure called the barium swallow. It's all about how a simple, kind of chalky drink can become this incredibly powerful tool that lets doctors see what's going on inside your esophagus and stomach in real time. Let's dive in.
You know that feeling, right? We've all had those moments. Something just feels a little off when you eat or drink. Well, turns out those aren't just little annoyances. A lot of the time, they're signals, and the barium swallow is one of the best ways doctors have to figure out exactly what our digestive system is trying to tell us.
So, that brings up the big question. Why on earth would a doctor ask you to drink this stuff and then immediately start taking x-rays? What are they actually looking for in your upper GI tract?
Well, there's a whole range of symptoms that this test helps investigate. It could be something super common like heartburn that just won't quit, or it could be for more specific problems like dysphagia. That's just the medical term for having trouble swallowing. It's an absolutely crucial tool for spotting physical issues, things like hernias, narrowing, or blockages, or even problems with the muscles that are supposed to be pushing your food down.
Okay, so how does it actually work? How can a drink, a simple liquid, suddenly make your internal organs, which are all soft tissue, just pop into view on an X-ray? The science behind it is actually pretty clever.
So at its core, a barium swallow is a special kind of imaging procedure. The main goal is to get a really clear, detailed look at your upper GI tract, especially your esophagus. And the secret ingredient, the magic bullet, is barium sulfate. That's what we call a contrast agent.
And this analogy is just perfect. Think about it. X-rays normally just pass right through soft tissues like your esophagus, which makes it totally invisible. But barium is dense. It blocks the X-rays. So by drinking it, you are literally temporarily painting the inside of your esophagus. This allows its shape, its size, and how it's working to be captured as this perfect, clear silhouette on film.
What's really interesting, though, is that it's not a one-size-fits-all test. In what's called a single contrast study, they just fill the esophagus with barium to see its overall shape and how it moves. But if they need a closer look, they'll do a double contrast study. For that, you get a thicker barium that coats the walls, plus an effervescent powder, kind of like Pop Rocks, that releases gas. That gas expands the esophagus, which lets them see all the superfine details of its inner lining.
So you know why you might need one, and you know how it works, but what's it actually like to have a barium swallow? Let's walk through what the patient experiences step by step.
The whole process is actually really straightforward. First, you'll do a little prep, which usually just means not eating or drinking for a few hours. Then comes the main event. You're given the barium and asked to swallow when they tell you to. As that liquid makes its way down, the radiologist is taking a series of x-rays, watching it happen in real time. They might ask you to change positions or lie down or drink a bit more, all to give the team different views. It's all about capturing the complete story of how your esophagus is functioning.
And now for the big payoff. All that preparation, all those steps, they all lead to these incredibly revealing images. Let's take a look at what doctors can actually discover just by looking at these X-ray shadows.
Okay, before we get into the really wild-looking stuff, we have to establish a baseline. This right here, this is what a healthy, normal esophagus looks like during a barium swallow. Just notice how smooth it is, a straight, clear path for the barium to flow right down. No bumps, no blockages. This is our normal.
Now, look at this. It's a complete contrast to what we just saw. This is called a diffuse esophageal spasm. The muscle is just contracting all over the place, irregularly, which gives it this corkscrew or sometimes rosary bead look. You can immediately see why something like this would cause pain or make it really hard to swallow.
This next image shows a really classic finding that radiologists call a rat tail appearance. You can see how the esophagus just suddenly gets super narrow, tapering into this thin little line. This kind of severe narrowing or stricture is a huge red flag that doctors investigate for serious conditions like carcinoma. It's a critically important visual clue. And here we have another really distinct shape. This condition is called achalasia. See how the esophagus is wide and then tapers down to this sharp point? Radiologists call that a bird peak appearance. And what's happening here is that the muscle at the very bottom, the valve that lets food into the stomach, is just not relaxing and opening properly.
Check this out. In this image, the test has revealed this super thin membrane. It's almost like a tiny shelf that's growing partway across the inside of the esophagus. This is called an esophageal web. You can even see what's called a jet effect, where the barium is being forced to squirt through that much smaller opening.
And finally, here's a really common one. That bulge you see right there, that's a hiatus hernia. It's a crystal clear picture of the top part of the stomach actually pushing or herniating up through the diaphragm and into the chest. This is a super frequent cause of things like heartburn and reflux.
Phew. So, now that we've seen the incredible diagnostic power of this test, it's really important that we wrap up by talking a bit about safety and summarizing the main takeaways. Now, like any medical procedure, there are some risks, though it's important to say they are rare. The biggest concern is a perforation, basically a hole in the esophagus. If a doctor already thinks there might be one, they won't do this test. A very, very rare complication is the barium leaking through a hole they didn't know was there. The other risk is aspiration, which just means accidentally breathing the liquid into your lungs. But these are all things the medical team is highly trained to watch out for and prevent.
So when you boil it all down, the barium swallow is really just a fundamentally simple idea, isn't it? You take a drink, and that drink goes on a journey that reveals an incredible amount of information about your health. It's just a testament to some really clever medical thinking.
And that kind of leaves us with a final thought. This is just one of many, many ways doctors have figured out how to see inside of us without ever making a cut. It really makes you wonder, what other secrets is our body just waiting to tell us? And what kind of new windows will medical imaging